I'd like to talk to you for a moment about a new mobile pain treatment program specifically for neuropathy. A lot of you out there suffer from chronic peripheral neuropathy from a range of causes, but everyone knows it's very difficult to deal with. It's very painful. A lot of physicians and doctors have a hard time treating it. It's not very easy to work with as far as conditions go. There's a lot of different symptoms: burning, numbness, pain and tingling, a variety of symptoms and a variety of causes. But ultimately, neuropathy is very difficult to treat. Most physicians simply prescribe medication for as long as it will work. And we've seen this for years. Patients come into the treatment program we're about to talk about here, having been on medications for years, maybe even decades. Medications weren't off, not working. A lot of you out there probably can relate to that. And only to find out that there is a treatment that actually works for them and can get them out of pain. And in fact, is so effective that you'd be surprised you haven't done it before. So what we're working with here is called neurofunctional pain management. This is something that I put together back in 2018 and started putting this in physician offices around the country. Ultimately, now I operate it as a mobile program. Around the country, we've discovered that the majority of the patients, or a large number of them anyway, can't really even make it into the offices for the treatment. So the people that need it the most really can't even get into the office. And the people that did actually come into the office, oftentimes they would simply quit coming in the moment that they started feeling better a little bit. They would just quit because they didn't want to keep coming into the office. But as I'll describe here in a moment, that there's a cumulative effect, and you need to keep pursuing the treatment program and complete it for it to work for a long period of time. So, neurofunctional pain management is composed of three categories. You've got electroanalgesic therapy, you've got an IV nutritional hydration therapy, and health coaching. So, electroanalgesic therapy is a high pulse electrical current. This is stimulating the neurons directly. This type of treatment can actually produce what's called neuron depolarization. So it actually can essentially can treat pain that way. Another aspect of this is that once you do stimulate the nerves, you stimulate the release of a range of neurotransmitters and neuropeptides, and those have a lot of benefits for patients as well, as we'll describe. But ultimately, this technology has been in the market and approved for treating pain for over 30 years. So that it's not brand new. It's been around, it's established, but only a handful of doctors around the country actually work with it. And I'll explain why very quickly here. It's just the treatments themselves take a little bit of time. So when you go into an office, if a physician or a doctor were working with you, they would have to connect you to the device, to the machine, and effectively run the treatment program for an hour, and then you would leave. And then you have to do that twice a week for 8 weeks. And that's the treatment program that we have. So twice a week for 8 weeks. You can see how that could actually be inhibitive for somebody to get into an office that frequently to get the treatment program. But you can also see why a lot of doctors probably wouldn't even offer it, because for them, that's not how their office is designed. Most of the doctors out there, especially pain doctors, they are centering now. When they used to be that they were a lot of them were centered on medications and prescription cycles, things like that. Now, what you see is a lot of pain doctors are focusing in on interventional procedures, right? Which is it's a good shift away from opioids and medications, but it still is an invasive procedure. You're looking at, deep injections into the spine, ablations, and all sorts of other interventional procedures. There's a range of them, and also too ultimately spinal cord implants and surgeries and all these other devices that are surgically, implanted and removed. So that's what a lot of pain doctors are doing now. So you can see why something like this that requires time for a patient to sit, on this machine here and be treated would not be terribly attractive as far as efficiency goes to a doctor. So that's what you're looking at. That's why most doctors just do not use it. I've met plenty of doctors who know what it is and say, "Oh yeah, this works great. I've seen patients get off pain, get out of pain with this, and they still don't use it. It's just inconvenient for them." So converting it to a mobile program changes everything, because now we have a team of nurses all over the country that will travel out to your home and treat you in your home. So you don't even have to go into the office. So your chances of completing the whole program are much, much higher, much better, because they're coming to you. And a lot of these nurses are very happy and friendly, and they'll be, friends with you, and they'll actually get to know you for weeks and weeks as they treat you. So that being said, the mobile program is the future of neurofunctional pain management. So electroanalgesic therapy, as I mentioned, is the first component, works amazingly well. Uh, the second component is an IV nutritional hydration, and this is a basic vitamin mineral mix, but it is administered in a fluid that's enough to help people overcome their dehydration issues and their nutritional deficiencies. And nutritional deficiencies referring to vitamins and minerals that typically a lot of pain patients are deficient in. So the combination of electroanalgesic therapy and the IV therapy typically is a very winning combination for relieving pain. The last component of that is health coaching that I mentioned. Health coaching is simply one of our nurses reviewing health topics with you and working out a plan for how to help you get to better health. We've added health coaching in over the years because we've noticed that as you start getting out of pain, one of your preferences is to now be healthier. I'm going to get up and walk. I'm going to go out and do things. And I decided I want to start eating better now for the first time in years, because before, if you are living in chronic pain, and there's not a lot of motivation in many cases to try and be healthier. But now that you're out of pain and you're running around and doing everything again, all of a sudden now you want to be healthy and there's motivation there. And we've noticed this with hundreds and hundreds of patients once they start getting out of pain. So that being said, this treatment program across the country, treating thousands, maybe even tens of thousands of patients across the country, we've seen an 85% success rate across the board, across all the different conditions that we've treated. 85% success rate of achieving a greater than 50% reduction in pain. And that's pretty remarkable. If you were to talk to pretty much any doctor or pain doctor or regular, doctor of any kind, they would say that's a pretty impressive statistic. And that's been collected from all the doctors we've worked with, and we would get their opinion. And it's a subjective opinion from the doctors. So it's doctors telling us, we ask them, what do you think the efficacy is among the patients you've treated, doctor? And that's their reply. We've had a few doctors who would say, yeah, across the board, it's 85%. But when it comes to neuropathy, I think it's probably closer to 90, 95%, they would tell me. I had a doctor who had a very strong success rate with knee osteoarthritis. And so he was seeing a 90% success rate with that. But then kind of lowered it to 85 across the whole board, because there's 24, I think 24 different pain conditions that we treat with this program. So there's a lot of different pain conditions. Some of them are a little bit difficult to treat. Some of them don't have as high of a success rate, as far as getting out of pain, but people do respond differently. So just because, one condition has a 90% success rate, and in this other more difficult condition, or this more, rare pain issue has a 75% success rate, that just means that, 75% of people are going to achieve a greater than 50% reduction in pain. And a large number of those people will still be, entirely resolved of pain. So that's what you're looking at, even with the more difficult conditions. We've seen people from every type of pain in every scenario achieve full resolution of pain. Some people are very responsive physiologically. Their bodies just are very responsive to this program, and they'll be out of pain within the first couple of treatments. And it's wonderful. Some people do have great and quick responses. Then other people, it takes a few weeks. We'll do the treatments on them, and we're 3 weeks in, and I can't really tell anything. It's not really helping. And the solution here is there is an effect that occurs over time. And so we tell them, look, you do have to keep trying this for it to ensure if it actually works. We've seen so many people, I would say many dozens of patients, where they were getting close to halfway through the program and hadn't really seen any real success, a few benefits, but not really any significant pain relief. And then all of a sudden, they cross the threshold. And that next treatment, boom, most of the pain is gone. And then it stays gone for the rest of the treatment. And then they end up going for 3 to 6 months without any pain. So that's a pretty impressive scenario for any patient. We've seen that many, many times. And I've talked to doctors who will tell me, yeah, I've seen, all these patients where, they didn't see a whole lot for the first couple of weeks. And then in week 3 and 4, all right, all of a sudden all the pain's gone and they're excited. And sleeping better and eating better and getting exercise and all these great things. So that being said, that's neurofunctional pain management. It is covered by Medicare and commercial insurances. It's a matter of getting your insurance verified. I have a link in the content of this video. You can click there and it goes straight to our site where we can get your insurance verified. You just submit the basic info. My team will take care of that for you. And again, we have a mobile nurse that will actually come out and treat you for this. So everybody here in Arizona who is suffering from chronic peripheral neuropathy, if you would check this and see, check your insurance on the link here, let one of our nurses work with you. We can work with you to get you out of pain. It's covered by Medicare and insurances, 85% success rate, non-pharmaceutical, non-surgical, non-invasive. Uh, there's a lot of wins here for that. It's very difficult to not want to try this, knowing that it's safe, it's effective, and it's covered by insurance. So I encourage you to work with us, give us a chance. We are RELATYV Mobile Pain Treatment Program, and one of our nurses will come out to you. So look forward to hearing from you, and thank you so much. Have a wonderful day.